Hey everyone, and welcome back to the MediByte channel. I am so thrilled you're here with us today. As your friendly neighborhood healthcare professional, I've got a brand new explainer for you, and we're tackling a topic that affects literally millions of people, yet somehow it's barely ever talked about. We are diving into abnormal uterine bleeding, or AUB. We're going to look really closely at what it actually is, why on earth it happens, and most importantly, what you can do about it. So let's jump right in.
Here at MediByte, our whole mission is empowering your reproductive health with really clear professional medical insights. And look, if you clicked on this video today because you've been dealing with some sudden, totally unexplained changes in your natural cycle, I want to tell you right off the bat, you are in exactly the right place to get some answers. It is incredibly anxiety-inducing and honestly just frustrating when our bodies don't behave the way we expect them to. But we're going to break down the science together and give you a really clear roadmap of what might be going on. All right, here's our quick game plan for today's explainer. First, what is AUB? Second, we'll cover the symptoms. Third, the underlying causes. Fourth, diagnosis and testing. And finally, number 5, treatment and next steps. Okay, starting right at the top with section 1, what exactly is AUB? Let's define it. So normally, a menstrual pattern is this regular, fairly predictable cycle that's driven by a beautifully complex hormonal system. But abnormal uterine bleeding, it completely breaks that natural rhythm. We're talking about bleeding during your reproductive years that happens way too frequently, is highly irregular, drags on for much longer, or is significantly heavier than your typical period. Basically, it's a major disruption in your body's biological rhythm. Now, while AUB can absolutely happen to anyone during their reproductive years, we see it incredibly often during 2 very distinct life phases, the natural beginning and the natural end of the reproductive timeline. So that means adolescent girls who are just starting to menstruate and women aged 45 and over who are navigating perimenopause. If you fall into one of those groups, please know you are far, far from alone in dealing with this.
Moving right along to section 2, identifying the symptoms. What should you actually be looking out for?
The crucial thing here is knowing these specific parameters, the actual numbers. Clinically speaking, bleeding flags as abnormal if the first day of each period is fewer than 24 days apart. It's also abnormal if the number of days between your periods is wildly bouncing around all over the place, or if the bleeding itself lasts longer than 8 days. Another massive red flag is heavy bleeding, which is defined as losing more than about 3 ounces of blood. And finally, intermenstrual bleeding. That's just a fancy medical term for bleeding that happens randomly right in between your normal periods. These aren't just abstract medical numbers. This is the very real, everyday reality a patient might be living with, and they are clear-cut signals that it's time to have a chat with a healthcare provider. But why does catching this matter so much? Well, continuous abnormal bleeding isn't just annoying. It takes a severe, literal toll on your body. Chronic blood loss actively depletes your body's vital iron reserves. If that's allowed to just continue unchecked, it leads straight down the path to iron deficiency and sometimes full-blown anemia. You absolutely cannot ignore these symptoms because your body simply wasn't built to sustain that kind of chronic loss. All right, let's get into section 3, uncovering the roots. Why does this actually happen? In the medical world, we cleanly divide the potential causes of AUB into 2 main buckets, structural and non-structural. Structural causes mean there's an actual physical abnormality inside the body. Think of things like growths, polyps, or fibroids. It also includes adenomyosis, where tissue grows directly into the uterine wall, precancerous conditions known as hyperplasia, and in some cases, cancer. On the flip side, we have non-structural causes. These are the underlying systemic or hormonal issues, so blood clotting disorders, side effects from certain medications or contraceptives, and a really big one called ovulatory dysfunction. And that brings us to a super critical definition. Ovulatory dysfunction, which we clinically call a UBO, is the single most common non-structural cause, and actually, it's the most common cause overall. Think of your reproductive cycle like a delicate biological feedback loop, like a perfectly timed symphony or the gears of a clock. With ovulatory dysfunction, that mechanism just falls completely out of rhythm. The ovaries don't regularly release an egg, and that single missing step throws the entire hormonal balance into total chaos. Let's geek out on the mechanics of that hormonal symphony for just a second. Normally, estrogen builds up the lining of the uterus, right? And then progesterone steps in to help control it after an egg is released. But if no egg is released, estrogen levels just stay high and totally unchecked. There's no progesterone to balance it out. The result? The lining of the uterus just keeps thickening and thickening and thickening, a condition we call endometrial hyperplasia. Because there's no progesterone to signal a clean break and shed the lining properly, this overgrown lining eventually just sheds on its own, but in a really incomplete and irregular way. And that right there is exactly what causes that unpredictable, prolonged, and incredibly heavy bleeding.
So what throws a wrench in this delicate rhythm in the first place? Well, the triggers are actually pretty vast. They can range from internal issues like PCOS or thyroid problems to natural life transitions like perimenopause. But get this, it can also be driven entirely by external factors, things like extreme emotional stress or even poor nutrition. Your hormonal balance is exquisitely sensitive to what's going on in the world around you.
Let's shift gears to Section 4, Diagnosis and Testing. Let's demystify what actually happens at the doctor's office. Getting an accurate diagnosis follows a very predictable, stepwise clinical process, which is great because it means you know exactly what to expect. Step 1 is always the menstrual history interview. Your doctor's going to ask a lot of detailed questions about your bleeding patterns. Step 2 is a physical exam and, interestingly enough, a pregnancy test. And yes, that is standard procedure even for teens or women entering menopause. It's just a box we have to check. Step 3 involves blood tests to look for anemia and clotting issues, plus hormone tests to check things like thyroid or prolactin levels. And finally, Step 4 brings in imaging or procedures, like a pelvic ultrasound or an endometrial biopsy. Let's talk about those advanced tests for a second. Why do we even order them? Well, a pelvic ultrasound is mainly used to check for those structural causes we mentioned earlier. The doctor is literally just looking for polyps or fibroids or measuring exactly how thick that uterine lining has gotten. Now, an endometrial biopsy, which is where a tiny little tissue sample is taken, is incredibly important for screening for precancerous cells. This biopsy is especially standard for women who are 45 and older or folks with specific risk factors like obesity, just to make absolutely sure that the thickened lining hasn't started developing any abnormal cells.
And finally, Section 5, Treatment and Next Steps. How do we actually solve this? The really good news here is that when it comes to treatment, you have options, and the choice depends heavily on you. Your doctor will look at your age, how severe the bleeding is, the state of your uterine lining, and, super importantly, whether you want to get pregnant in the future. Based on all that, the options generally fall into non-hormonal medications, hormone therapy, specialized procedures, and of course, iron supplementation to build back what was lost and treat any anemia. For women who actively want to become pregnant, or maybe you just really want to avoid the side effects of hormones, non-hormonal options are going to be your frontline defense. We're talking about standard NSAIDs like ibuprofen or a specific medication called tranexamic acid. These are primarily used to manage and turn down the volume on that heavy flow without disrupting your body's natural ovulation cycle.
Now, if pregnancy is not the goal right now, hormone therapy is amazingly effective. This usually involves combination birth control pills, so estrogen and progestin, or sometimes treatments that just use progestin alone. Remember that broken clockwork mechanism we were talking about? Well, adding these hormones back into your system basically hits the master reset button. It enforces a normal shedding schedule, dramatically cuts down on cramping, stops that unchecked lining thickening, and actually lowers your risk of certain endometrial cancers. It's a real game changer. Sometimes, though, medications just don't do the trick, or the lining is already showing some precancerous changes. In those cases, we look at procedural interventions. These can range from a hysteroscopy with a DNC to safely clear out that overly thickened lining, to an endometrial ablation, which basically destroys the lining to stop the bleeding for good. There's also fibroid embolization to cut off the blood supply to any troublesome fibroids. And if the bleeding continues to be severe and completely life-altering after trying everything else, a hysterectomy, which is the complete removal of the uterus, might be recommended as a final, definitive solution. Which brings me to a question I really want to leave you with today. Have you noticed a sudden, unexplained change in your body's natural rhythm? Look, your body is an incredibly communicative system. If it is suddenly breaking its own patterns, it's trying to tell you something. Please do not ignore heavy or irregular bleeding. Take charge of your reproductive health, listen to what your body is saying, and go have that proactive conversation with your doctor. There is absolutely no reason to be afraid. Thank you so much for hanging out with me today for this explainer. If you found this breakdown helpful and empowering, please hit that like button, share it with someone who might need to hear it, and subscribe to the MediByte channel. We are completely dedicated to bringing you the clear, trusted medical insights you need to live your absolute healthiest life. Until next time, take care of yourselves and stay curious.